coming right now, and we're actually a little early. This is great. I love to be ahead of schedule. We're going to discuss high expectations, right? And to moderate this panel, the founder of Kind Selections and the co-founder of Cannabis Tolling Solutions, please welcome Tim Powers. Yay, Tim. And the rest of the panelists, come on out as well. You all have a wonderful time.
Hello, everyone. Just the way it is. Hello. There we go. Hello, everyone. Okay, so we're here today to discuss high expectations, how consumers are shaping marketplaces. We have a number of guests here who are all kind of in different fields, so I'm going to let them introduce themselves, and then I thought we'd throw a question at them, let them all answer it from their own perspectives of the market they're in. And if we have some time, maybe follow up with the second one and then throw it to you guys. So please introduce yourselves.
Hi, everyone. It's very nice to be here. My name is Emily Fisher. I'm the founder and CEO of LeafWell. LeafWell is the leading platform for cannabis care in the US. We've seen more than 500,000 patients over the last 5 years across 38 states. We've published research, and more recently, we've begun working with employers to offer cannabis care as an employer-sponsored benefit, which is the first major step toward a future where cannabis will be reimbursable in the US. Thanks.
Hi, my name's Tanner Stewart. I run a wellness-focused company out of Canada called Stewart Farms. We built an entire category in Canada. I like to call it the medical bathing category. I've got 3 bath bombs here beside me, so THC, CBD infused baths. You can look at a bath 2 ways. You could say, well, it's not a very effective way to get drugs on your body, or you could say it's the most effective way to cover your body in drugs all at once. And that's how we like to think about it. And and we have a line of muscle products. Arctic Heat is our version of Icy Hot or Tiger Balm, heavily infused with THC and CBD, and we're well on our way to being number 1 in that category of topical and muscle relief in Canada as well.
Name is Chris Sinakori. I am the CEO and founder of 3Win. We are a global distributor of vape hardware. We currently distribute to about 17 countries, and it is great to be back at ICBC. We were here last year, and it's bigger and better than ever, so this is awesome to be here, and thank you.
My name is Lawrence Minks from Research Gardens. I'm a strategic consultant. I help businesses doing their strategies, but also facility planning according to the strategy, to the product quality they're aiming for, and also doing quality management systems. I'm observing the cannabis consumers since 2018 in Germany, then Africa, and also Switzerland since 5 years. I had my own social club in Spain. Now I have my own. I'm not having my own, but I'm participant in a pilot project in Switzerland. And I'm always curious, like, what the people like, what they don't like to smoke, to consume. And yeah, I'm interested what you guys will say.
All right. So we have very differing and diverse backgrounds in terms of the cannabis businesses being run here. And I thought it'd be interesting to ask them all and let them answer individually how the consumer preferences are forcing you guys to maybe change your business from how you originally thought it would be, or your original models, or what you're doing to get ahead of what you perceive to be these new trends. And we could just
I am very happy.
go down the line.
Yeah, I'm happy to go first. Again, it's interesting to be here in Germany because I actually live in London. My business is in the US, and it's my first time at ICBC. But it definitely feels like an exciting time in Germany. There's a lot of American folk here, and I've heard several times that this is like 2016 in California. And I think the focus right now in Germany is access. Let's give people access. And in many ways, at least my understanding, I may be wrong, I'm learning a lot, I'm here mainly to learn, we're moving a lot of people who are shopping the illicit market into the legal medical market. What comes after that? You know, I've been in the industry since 2016 in California, worked in the industry for 3 years and then started LeafWell and have been running it for the past 5.5 years. But what comes after that is really a growing number of kind of curious. That's what I call sort of the group of people that are increasingly interested in using cannabis for therapeutic outcomes, but are not yet consumers. And I think the difference between now and 2016 in California is that there's a lot more people who know that cannabis can be really effective for therapeutic reasons. And so I think what we're focused on at LeafWell is normalizing cannabis as medicine and speaking to those people. They're the people that don't go to the doctor right away. Maybe they have questions, or they haven't walked into a dispensary or pharmacy yet. But they are interested. So education is a big part of that. Research is a big part of that. But really bridging that gap, and I would say that shaped a lot of our strategy.
Wonderful.
Yeah, we've been in market with our products 3.5 years, going on 4 years. What lessons haven't I learned the hard way? Name. What's in a name? Everything is in a name. When we launched our first 3 bath bombs, one was Bubba Kush, one was Blue Dream, and one was Trainwreck. And what we did is we copied the terpene profiles of those genetics, but we did it with the botanical essential oils. And part of it was just us trying to teach people the differences between this is the essence of Blue Dream, this is the essence of Bubba Kush. But Trainwreck... When we launched that one, we thought, people are going to be like, oh, I feel like a train wreck. This is going to make me feel better. What people thought was it's going to make them a train wreck, and that bath bomb bombed, pun intended. So it didn't work out real well. So now there's one called Chocolate Hashberry in here instead of train wreck. So that was sort of an early on lesson. The topicals category in cannabis is one of the smallest categories in the whole cannabis space, so it's really quite niche. But one thing we've seen a lot of in the 3.5 years in this category specifically is innovating too far ahead of what the market is ready for in things like skin creams and topicals in general. The primary category is muscle relief, right? We built the bath category, but I've got a couple muscle creams over here. People are seeking, for the most part, a muscle relief cream, right? So that is sort of the bulk of the entire cannabis topicals market. And well below that, below muscle relief, which is really the primary, then you have skin. And skin is way down the chain in what people are ready to try out in the topicals category. So we have one skin product in the market, and it's sort of an all-purpose skin everything. I say use it like Frank's Red Hot sauce. You got a burn, you got psoriasis, you got eczema, you got whatever. Use this lavender and arnica THC CBD cream, and it's just kind of good for everything. And that product, we're just using that to get people used to the idea that I should use CBD and THC for skin issues as well as muscle relief. But the market is not ready for CBD face masks. It's not ready for, special CBD infused serums, this and that and the other thing. It depends on your distribution channels, of course, and it depends on your market a little bit. But we put THC in a lot of our products. So that's really sort of an ongoing lesson right now. It's like layer number 1 is get the market used to going to THC and CBD infused products for these types of things, and stay away from the really, really obscure things right now in the topicals category. And that's what we've seen. We've seen tons of companies come in with super niche products that didn't survive. So.
That was awesome. So unlike that, the vape category, which we are in, is a pretty mature category. 3Win, we've been around for 10 years now. We first launched as a distributor for CCELL. I'm sure most of you have heard that name before in the vaping category. And we just, we're in our 10th year right now. And we've been very fortunate in so many ways to see how vape has really come along and revolutionized the industry in the US for so many years. But we're really at the tip of the iceberg as far as innovation, because we continue to innovate on the vape side of the business. And if you were here on day one when Charlie Batchel, the CEO and founder of Cresco, spoke, it was really interesting to hear him speak in reference to what he has done at Cresco with producing a brand. Right? Cresco is a brand, and Cresco is going to offer consistency in their product. And they're also going to offer a certain culture. So when you think about the vaping part of Cresco business has delivered all three of that. And that's really what 3Win does. We take companies just like Cresco and we help build a better business with them as true partners. Because our responsibility as the distributor for vape hardware is significant. And we have to make sure that we're delivering and we're innovating at our level to have somebody who starts a business who's as large as an MSO as Cresco and other large MSOs that we work with, like the True Leafs and the Curaleafs. And there's so many large MSOs in the States that when you're building your brand through the vape hardware aspect, it has to be great. It can't just be okay, because these businesses are made on the consistency of the product. They're putting their great oil into a product. That product has to perform. So as a distributor of vape hardware, we have to make sure that this is going to perform all the time at a great level. And that's how you build brands. So I think 3Win as a whole, we really assist businesses. And I know everyone in this room, we're business owners and you're starting businesses. And it is crucial that each of us, when you bring products into your threshold, that you pick the right products, because we've seen we have about 2,000 customers that we deal with on a yearly basis every year, and it's amazing how many come and go. But the ones that stay and the ones that grow and the ones that become profitable are the ones that find products that are good and they continue to innovate on the same product.
Thank you.
Thank you. I'm German, I like history, so I just bring you on a little history about German consumption behavior or how I could observe it. I started in 2019 blogging about cannabis. This was my first touch point after enjoying the benefits for my neurodermatitis of smoking joints. And then I thought, oh, maybe it's like not just me and not just my friends I know of, but maybe it's a bit of bigger thing. Back in the days, Germans, they like tobacco and haze, and I still think they like it still now. But what I also discovered was when we were writing on our blog cannabisrausch.de about THC liquid, it made like 50% of our traffic. So out of the 100,000 clicks per month, we got 50,000 clicks every month for THC liquid. So this was like a big change in interest, at least. Everyone wanted to have something to vape without having the harmful tobacco, without having the harmful benzols and everything that gets created when you burn a joint, when you burn cannabis. And I think this is always the story about like cannabis and legalization, like governments wants to reduce the harm of cannabis consumption, and there must be ways to consume it better. So I really love the story of the bath bombs and also of the patches. I wrote an article in 2018 about cannabis patches, also good traffic, but there is no patches in Germany, right? Because it was illegal. There was also no bath bombs, but there came bath bombs in the CBD field. But still, even like with the THC liquid, what had high traffic, high interest in search requests, people in Germany, they still smoke tobacco and haze because they are addicted to tobacco. They are smoking joints all the day. They say, oh, no, I'm not addicted to anything, but they are nicotine addicts, right? So they just don't know because they always associate the effects of the mix between tobacco and haze. And I think this is something that really differentiates North America and Germany. We have abundance of cannabis in North America, so it's cheap. you can smoke 5 grams, 10 grams per day without getting broke. In Germany, you always needed to be more sensitive because it's more expensive. If you get caught by the police with cannabis, you get hefty fines. So this is something I really discover, like people want to get rid of this, harmful consumption method. But on the other side, they are addicted to a substance which is not cannabis, but which is historical in their joints. So this is something I see with the medical legalization that happened 2017 in Germany. People now get access to cannabis from legal sources in a more, medicinal way. It's not like the shady black market thing. You go to something in the park and get your cannabis from, but you go to a pharmacy or to an online pharmacy. Everything is in white and in blue and really clean colors, really clean packaging, clean products. This is also what we are doing with Carbon Active. We are building facilities for a clean product without microbials. And now people start thinking more about not only which strain I smoke, do I mix it with tobacco, but they're thinking more and more, do I smoke like a clean product? And this is like what I could discover in the last 8 years. People are thinking more about product safety, about harm reduction and other ways. But until everyone is vaping or like doing patches or bath bombs or edibles, it's still a long way. Edibles are not even legal with the German legalization. So I think this is where we are now. In Switzerland, in the pilot projects, we see there is a demand for edibles, but it's still a little niche. So I think this is now maybe the next 8 years. We can sit here again and maybe I get invited to this panel again and then we can talk about the rise of the edibles.
Wonderful. Okay, so maybe I'll just open it up to whoever wants to answer this. How do you guys see navigating all of the different countries coming on board, the different legal frameworks, whether it be medical, recreational, whatever? What are you guys doing as companies to either come out of Canada or the US or Germany? What are you guys' thoughts? And how will like the consumers of those different marketplaces form your decisions?
I could speak to that on the topical side. Our form factors are obscure and niche. I assure you there was nothing in the Canadian regulations that accounted for drug-infused bath bombs. That wasn't a consideration when the regulators were writing their regulations. So in Australia, as an example, we're currently going through the process of seeing if we can get because we have THC in ours as well, right? So it's THC and CBD. We could probably launch pure CBD ones in Germany tomorrow, but the THC makes a difference. So we want to leave that in our product wherever we can. So in Australia and Germany, that kind of puts you in two different sectors of the market. So just getting a form factor recognized by the regulatory body is a hurdle for us. So it differs country by country.
First, it's more of a regulatory hurdle right now for you versus the consumer demand.
Yeah, because once people see, I can get a THC CBD muscle cream, or a doctor knows they can prescribe it, they get that pretty quick. They can latch on to it. But yeah, for us, it's primarily regulatory per country. Yeah.
And what about you, Chris? Do you find hardware needs or preferences or regulatory requirements differing as these jurisdictions open up?
Absolutely. So that's been a large challenge of different countries that are coming on board is the whole vaping issue. Obviously tobacco is so worldwide and much more regulated in a different way. But from a standpoint of THC or CBD vaping, like Australia is just now kind of opening up and they have certain regulations, and we're just seeing like the UK and Germany. These are all things that are in the near future, but the regulation is just not there yet. And
maybe Lorenz can answer this one. What do you think about, you touched on it a bit about differing consumer use patterns, say, between America or Canada and Europe. A lot of people that I talk to in Europe say that they think these patterns will continue. So what do you think as access becomes easier, as products become maybe cheaper, do you see changes coming from consumers?
Absolutely. For example, when we look in the Swiss pilot projects, where I'm also a participant, so I'm filing the study questionnaires, and I get feedback also from other pilot projects in other regions, and also my own in where I'm attending in Switzerland, in Zurich, about the preferences about the THC potency. So this is an interesting part, because in Canada, when I was sourcing for medical companies, was always the same. The highest potency is winning. The customer hurts, right? It's the most easy parameter that you can look on and say, this is a good product, not a good product. But of course, like the bubble, we all know terpenes are the thing, right? And other volatile compounds. But in Switzerland, you have a limit of 10 gram pure THC per month, which you can legally get, right, from your dispensary of the pilot project. So the heavy consumers that smoke a lot, they tend to use more balanced strains because they can smoke more, right? You can smoke 100 gram of 10% strains, and you can smoke 50 gram of 20% THC strains. So there is a shift in the potency that the consumers like. Yeah, like we can see it in the statistics in the pilot projects. The interesting thing is, in Germany, it will not be that easy, maybe in the social clubs, but medical, it's really hard. And now we come to products which make it hard, genetics. There are no genetics where you can reliably grow cannabis with a balanced CBD, THC potency, because it's much easier to keep just one cannabinoid in spec. You know, if you say I have a 20% strain with THC, you can deviate from 19 to 21, from 18 to 22%. But if you have to check the CBD and the THC value, it's worse. Like if you go to Canada or to other more mature markets and ask what are the deviations from batch to batch in balanced strains, then you see it's deviating hard and you cannot market it on the medical market, right? But I think there is a huge demand, because too much THC can also be counterproductive against pain. So it can increase the pain in the body if you have too much THC. So I think balanced strains, it's something people want to get hands on, but it's just not available. And I think big part of it is that there are no genetics that are stable in keeping the right balance levels.
I find your interesting point about limiting the amount of THC and how that affected the choices they were making to be very interesting. Maybe we'll change it up a bit. Technology was supposed to be part of this. I cannot elaborate too much or talk too much about technology. I can hardly use my phone some days. So maybe I'll turn it over to our panelists to talk about that. Do you guys have any thoughts on AI, on technology, on things you guys will integrate, and how maybe the consumer might be involved with that?
So I think I can jump in there from a vape standpoint. Emily, would you like to know? Okay. I can jump in there from a vape standpoint. The industry is constantly changing, and each year we see all this new innovation. I mean, I know for C-Cell, we just launched around 8 new products just in the last year, because the consumer, which we listen to, and that's the number one thing right in every business. Listen to the consumer, because they're going to tell you what they want and the direction that we want to go to. So whether it's being more sustainable, whether it's being less metals in the cartridges, we're trying to accomplish every single avenue of which the consumer wants in vape hardware. So as far as technology, it's nonstop. We have postless now, where in a cartridge, if you're familiar with vaping, it's always been the airflow comes through a post in the center. Now they have postless. You have full ceramic, so instead of just a ceramic core, we have full ceramic cartridges now. We have different technology it's called heat, not burn. In the past, where when you vape a cartridge, it burns the oil, and that's how you get the vapor. Now it's just heating it instead of burning it. So they're constantly trying to look from a standpoint of a better vaping experience.
And would you say like that's driven by, say, customer feedback and customer service, and is it end user? Is it guys like myself calling you and asking for things? What do you see?
It's definitely consumer driven. Because in the end, the consumers are the ones that go to the dispensaries and they buy the products, and they want to buy the products that they feel are going to perform the best. So we're constantly trying to deliver that one aspect. But it's not only the performance being the best, it's the consistency of it. I think that's one thing that CCELL really delivers on in 3WIN, is that we try to deliver the same experience over many years of a vape cartridge that keeps just improving and getting better. You don't want an experience where you have a cartridge and each time it's something different. So we want to really, whether it's you're smoking liquid diamonds or rosin or resin or just plain distillate, the experience, we're just constantly trying to enhance it.
That's great.
I'll piggy off that. I completely agree. I think technology enables us to collect user feedback and product development in many ways. I mean, I can't speak to specific products, but product development is not at the stage where products are being developed to deliver a specific outcome necessarily. And I think that's where we need to get to. Certainly what we've seen is our consumers do know what they want. They want a specific outcome, and they're often using products because their friend recommended it, or someone in a dispensary recommended it, and that's not necessarily the best way to find the right product for yourself. So I think, whether it's telemedicine, I know that there's some platforms in Germany now that are seeing thousands of patients every single month, but it's increasing access. We're able to collect not just information about the individual at LeafWell, we're also capturing what products people are purchasing, we're getting their reported outcomes, we're getting clinical input, and I think that moves us towards a future where we can start really talking about product efficacy.
Yeah, that's great.
Yeah, I can speak to technology just from a communication and marketing standpoint and feedback positioning. We have just recently been permitted to put QR codes on our packaging in Canada because we are extremely restricted in how we're able to package. So this is a big deal for us because now we can attach, instructional videos on how to use our topicals properly. A lot of people, they just don't even know how to use a muscle cream correctly. Use it 2 to 3 times a day, to recover from the issue. And just being able to effectively communicate that to the patient or the customer is a big deal. The other thing we really focus on is encouraging the patient or the customer to tell us what they're using the product for. And, when we launched, so review collection is a big deal, because what that is for us is the anecdotal evidence to the future clinical trial that we'll probably run on a specific topical. This here is my lavender and arnica skin product I was talking about earlier. We call it Lavender and Arnica Skin Balm now, but originally it was just Lavender and Arnica Balm. And it wasn't until we got, a few dozen reviews back from the market, people saying, this is the first thing that worked for my psoriasis or my eczema. I can't, it's magic, thank you. And we just got review after review after review. And we said, oh, this is for skin, right? Because we just launched it. Of course, we thought it would be good for skin, but then the market told us what it was good for. We have a...
Hold on, and just for the record, Emily tried all these products in the prep room.
That's right.
Except for the bath bomb.
That's right.
Good.
And I have no fucking idea how they got here, honestly. I showed up in Germany. They were just here. I don't know how they got here, but...
I see a lot of that.
Yeah, there's a lot of that going around. So we had this muscle cream. We've got people, we've got ladies using it for endometriosis. They're just rubbing it on their abdomen to help them, get through the pain of this, issue that many suffer from. And this is a muscle product. Not for 1 second did I think, this might be good for external relief of somebody with endometriosis. So that's what technology is for us, really. It's that feedback loop. It's getting getting that ability to get that feedback from the patient and figuring out where we're going from here with our products.
I think that's a great answer. Something to add?
Yes, you've asked about AI. I think AI is always like a big name, right, behind. There are mostly simple algorithms or machine learning maybe. I see we can use machine learning in facilities, right, to optimize grow performance. For example, we are working on it in our facilities with Carbon Active. But I think on the consumer side, maybe it's too easy. Like I'm building a new cannabis software platform right now, and in the research I searched for how can I access strain data, right? Like from Leafly or other platforms. And when researching it, I found out there are techies who want to scrape like the data to get like patterns in which terpenes a strain has and which effects it has, like medically or like just in a positive or negative way in general. But I think this is too easy. Like I had this vision some years ago and discussed it with a big pharmaceutical company to match pattern or to see patterns between DNA of cannabis strains and DNA of human beings, right? Because it's always about patterns, but this is super expensive to just make a DNA test, not only on one or two loci, but like on the full DNA. It's super expensive also on the cannabis. So of course, theoretically you can do the patterns, but it's not realistic. And I think cannabis is something, it requires a journey from the patient or from the consumer. It's not like paracetamol or like ibuprofen, like you take it and you know what it affects you. Each body is different. Each strain is different. Like there are 100 different amnesia haze phenotypes, or in my Swiss pilot project, there's an amnesia haze, which is a kush. Like I smell it, it's not a haze at all. But people then look at Leafly, okay, which effects does amnesia haze has, right? And then they think, okay, this might affect me well, it has this and this terpene. They don't know what a terpene really is in real life. They select it in the pilot project and the effects are different than what they expected. So I think there's a lot of wrong data in the world of cannabis, and this is a big issue when it comes to AI. Maybe there are some developers who want to find patterns based on Leafly information for terpenes and effects and so on, and then, give you a recommendation which strain you need for your needs. But I think cannabis will always be a journey. So you start somewhere with a strain, you say, okay, affected me good or not so good. So we might have consumption diaries more and more in the future. I know Lisa Haag is working on something like that in Germany with some universities, which is nice because I think to give good data is the basis for any recommendations or artificial intelligence assisted systems. So I think all this AI stuff is maybe a bit too much promoted now to use it, because first we should here in ourselves find our balance, find out which body types we are, what we react to nicely and not so nicely, sure. And this will always be cheaper than some AI-assisted recommendation.
I agree with that. I mean, there's lots of bad data, there's lots of missing data in cannabis. But from a consumer perspective, from a patient perspective, there are some people who are prepared to be proactive and to go on a journey and to try different things and sort of, reflect on that. But a lot of people aren't. That is sort of the anti-pattern to how we experience healthcare or medicine. Sure. Today, and we've tried that. We provide people with product recommendations, and a lot of our recommendation is down to the clinical input. So we have thousands and thousands of consultations every single month. People want one recommendation. They want to be told. There's a big group of people out there. An estimated 38 million Americans who are interested in using cannabis who are not currently consumers, and those people want to be told. So I completely agree. We're not there yet, but I do think that cannabis can play a meaningful role as a trusted and integrated part of healthcare. But that's where we need to move towards. We need to get that data.
I think I'm going to jump in quickly and say I think there is a lot of incorrect, biased information that a consumer will read and assume they're smoking amnesia haze and associate effects with this. I've done it personally with just blind tasting people with jars. And so I think it's a combo of both. I think we need to finish this, though, and move on to questions. So I think there's a microphone out there. If you guys have any questions for these guys, let's fire away. Or I can give you this one if you need.
Hi there. My question, I think, is specifically to you, Chris. Given the unfortunate chapter, specifically in America, with EVALI associated to vaping cannabis, and predominantly from the black and illicit market, what measures are you as a stakeholder and your peers taking to ensure that people who don't want to consume flower in combustible methods, and demonstrably in the tobacco world and nicotine, vaping has been proven to be many magnitudes safer. How are you ensuring that that messaging is getting across, and how you're regulating your own products and your peers doing that, and how is that affecting the wider manufacturing processes?
That's really a great question, because one challenge that we have in the entire vaping industry, especially in the U.S., is, what are you actually smoking? Right? You go to a dispensary. So we have a lot of faith in, as far as what our manufacturer, what they produce, what we know they are producing, because we're overseeing the entire project from beginning to end. But then when it goes to the dispensaries today are so regulated, and they really have to put a quality product inside the device. So if you're outside of a dispensary, then that is considered a gray or black market. So what I always say to consumers is, if you're outside of the dispensary aspect and you're willing to take a chance on not knowing what is in the cartridge and what is the actual cartridge, where it's coming from, you're putting yourself at risk. So from a vaping standpoint, I feel like we do a really good job of staying out of the black market. We don't sell to the black market at all, because we want to make sure that our product is, top tier for dispensaries and for the health of patients as best it can be. Great question.
Anybody else?
I can just yell.
Alaria.
Uh-oh.
Expectations. I'm having a lot of hard time with the nomenclature: resin, rosin, and vaping. Does the panel have any opinions basically on the nomenclature that's going around between the products that we're talking about in the North American market? And Lorenz might be perfect for this. There's a lot of extracts that are free of solventless, that aren't hash or mechanical separation. How do you see the law and how it's been written, and how those interpretations can really change the market here in Europe?
Thank you for pointing the question to me. I did the first lecture in 2018 on rosin in Germany, and I thought I need to talk about how to place the heat coils in the rosin press and so on, but it was the first ever talk for many of the guys in Germany and girls to hear about rosin, right? So we are not that far. It's a young industry with extracts and with concentrates. I think there's a lot of confusion. What you said, there is like live resin and there is rosin, right? So many people, they don't know that there's a difference just by one letter between resin and rosin. And in the end, rosin is also resin, but resin is not always rosin. So I think there is a big, communication needed. So we have like great YouTubers like Der Mischa in Germany who are doing a great job in informing the people. And I think in Germany, people like to be informed, right? Germans are kind of nerds, so they like to learn something new. I don't mean other nationalities don't like it, but there is like a big learning curve in the last years to get these names right. But in the end, I think consumers really don't care. Like in the bubble, we care if it's like live rosin or if it's like BHO or it's done with a different gas or ethanol extraction. I think a consumer just wants to know if it's like somehow natural, like solventless, like hash, hash rosin, or if it has more terpenes or less terpenes. So maybe we can find something there on the nomenclature. I think it's the same also with indica and sativa, right? Like indica and sativa, we can describe like how a plant grows, like skinny or like more thick leaves. But in the end, it comes to, is the strain affect me in an energetic way, or do I go to sleep afterwards? So I think in Germany we have a really healthy information flow and learning curves, and I think also in other countries in the world, the more legal it is, the more people talk about it, the more informed they get. But I'm with you, there's a lot of confusion still.
May I ask another question in this context? Because when it comes to medical extracts in the pharmacy, I found out that the pricing is like 6 to 10 times as high as in Canada. And how can we achieve that the pricing in German pharmacies is the same like in Canadian or dispensaries in the US? Because I think this is the basic problem. If you want to have a medical extract prescribed here for 1,000 milligrams of THC, you pay 300-400 euro. And if you compare that to the flower, for 1,000 milligrams of THC, you pay between 20 and 100 euro. And I think this is the basic problem, and this is my question to the Canadian producers especially. How can we achieve that the nice extracts from Canada are the same, have the same pricing like in Canada?
Yeah, that's all Lorenzo's fault.
I think I could speak on that a bit. I mean, there's extra compliance, there's extra levels of there's just many extra levels, whether it's networking, whether it's building relationships, whatever. It's traveling. I don't think it's ever going to be the same. Should it be closer? It probably should. I would be speaking to the pharmacies about getting more out there and making more plentiful, and the ones that are, the few that are, and able to charge higher prices, you'll see that probably come down. And my company, Cannabis Tolling Solutions, if there's German companies out there looking for extracts, yeah, we're here to provide you good Canadian quality extracts at good prices.
You just started the price war in public.
No, we don't do price war stuff. So is there any other questions, you guys? I think we got to get off the stage here. There we go.
Thank you once again. Let's hear it. Let's hear it for Tim and the rest of the panelists. Thank you so much.